When I talk to people about naturopathy and ask them if they know exactly what it is and how it works, more often than not they tell me it's the use of natural or alternative therapies to treat diseases and health conditions. A lot of people think it's simply the use of herbs or vitamin supplements or certain foods or diets to treat health problems in much the same way as general practitioners use pharmaceutical drugs to treat various diseases. I'm often asked, David, what can you give me or what can I take to fix my gout or my hay fever or my arthritis or whatever it might be they're suffering from? But naturopathy is much more than that. It doesn't work as a quick fix or like an alternative drug. It's actually quite a sophisticated system of medicine. Here we have the Australian definition of naturopathy as documented in the National Health Training Package for naturopathy. We'll look at some of the concepts within this definition more closely in a little while. But before we do that, here's another definition. And this time it's the North American definition for naturopathy. It's the definition that was adopted by the American Association of Naturopathic Physicians, or the AANP. So through both of those definitions, you can see that naturopathy is a fair bit more than simply using natural alternatives to drugs to treat disease. Naturopathy is actually a whole medical system. A system of medicine is one which generally has developed over time, sometimes over hundreds or even thousands of years. And it represents a complete approach to healthcare. Generally not just a single therapy such as herbs or nutrition or bodywork therapy, massage or exercise therapy, but a multi-modality, multi-therapeutic approach to not only treating the disease but also preventing it, as well as promoting optimal well-being through healthy lifestyle choices. Some of the whole medical systems that have been around for many hundreds of years are things like traditional Chinese medicine, Ayurveda, which is the traditional medicine system of India, Unani Tib, which is an integration of ancient Greek and Arabic philosophies and approaches to healthcare. And there's also Tibetan medicine, which is really a combination or incorporation of aspects of traditional Chinese medicine and Ayurveda, as well as some shamanic approaches to disease as well. Although each of these different systems is different in some ways, they all share similar perspectives on health and disease, the promotion and the resolution of health and the prevention and management of disease. One of the things that all of these systems share in common is that they have each evolved a philosophical foundation along with guiding principles that direct practitioners in how to approach the management of health and disease. All of these systems employ a number of different therapies, such as diet, food as medicine, herbs or plant medicine as it's also called, or botanical medicine, some form of bodywork and exercise therapy. Another common feature is that each of these systems considers more than just the physical body in the prevention and management of disease. The mind, the emotions, and also the spirit are considered to be important factors as well. And in this respect, these are all holistic systems of medicine. So naturopathy is a more contemporary example of a whole medical system. Although its origins go way back in human history, its philosophy and its principles only really started to be developed in ancient Greece around the time of Hippocrates, and were really consolidated and refined only in the last century, in the 20th century. While naturopaths may use a wide variety of therapies in practice, the most commonly employed ones are nutrition and diet therapy, herbal medicine, lifestyle modification counselling, musculoskeletal therapies or massage therapy, homeopathy, and then there may be others such as flower essence therapy, aromatherapy, some naturopaths practice acupuncture, colloidal mineral therapy or hydrotherapy. When a naturopath employs nutrition and diet therapy, They analyse the patient's current food intake and make recommendations about how to modify it so that healthier food choices are made that will improve the health of the patient. Certain foods may be recommended or prescribed as medicines according to specific therapeutic properties the foods may have. In practice, I often prescribe juice therapy, where I list combinations of specific vegetables or fruits whose constituents and properties will assist in the treatment of the patient. One of my favourite juice recommendations for assisting with chronic low-grade inflammatory conditions includes fresh turmeric root, Granny Smith apples, purple carrots, fresh ginger root, and a few black peppercorns. Soups and broths are another great way of delivering concentrations of particular foods to provide a therapeutic effect. For chronic lower respiratory tract infections, things like bronchitis, chronic bronchitis, I recommend a soup that's made with watercress, sweet potato or pumpkin, garlic, onions, cumin, and fresh ginger. The watercress and the sweet potato and the pumpkin are wonderful rich sources of provitamin A, which is very, very important for the health of the mucosal membranes. Garlic and onion are antimicrobial and decongestant plants, and ginger is anti-inflammatory. Where necessary, supplementation of nutrients such as minerals, trace elements, vitamins, amino acids is often necessary when a disease is present, or where an individual is experiencing a higher than normal demand for specific nutrients. After significant surgery, for example, supplementation with certain specific amino acids, vitamin C, bioflavonoids, vitamin A, vitamin E, and zinc can really assist with the healing process and also reduce swelling and pain and minimise scarring that results from the surgery process. From a naturopathic perspective, recommended daily intakes aren't of any relevance or value to the naturopath a lot of the time. Optimum nutrition is about ensuring that your body is optimally nourished, and in times of anxiety or stress or mental and physical illness, the demand for certain nutrients can be much, much higher than normal. So the question that the naturopath asks is always, are you supplying the level of nutrients that your body's actually demanding? Plant medicine or herbal medicine, botanical medicine, was probably man's first medicine, aside from foods, that is. We know that animals in the wild depend on herbs when they're ill. Herbal medicine probably had its roots in the observation of the behaviours of animals. Each of the whole medical systems mentioned previously incorporate herbal medicine, and naturopathy is no different to that. Naturopaths draw from a materia medica that includes hundreds of different plant medicines from all corners of the planet. The study of herbal medicine is in itself quite complex and requires a considerable depth of understanding. It's also very satisfying to be able to gain an intimate understanding of how plants work and what they have to offer as healing agents. One of my very early successes, I suppose you'd say, in clinical practice was in the treatment of a young guy who'd recently returned from South America. And he'd had a very nasty condition that's known as leishmaniasis, something I'd never heard of at all until that time. This guy presented with quite a crater-like ulcer on the side of his foot just below the ankle. It was almost the diameter of a small tennis ball, and it was quite unsightly in appearance, and it gave off a really unpleasant smell. This condition, leishmaniasis, is caused by a protozoal parasite that's carried by sandflies. And although he was taking prescribed pharmaceutical drugs to fight the infection, his ulcer just wasn't improving, and this is where he was looking for some help. Among a number of things that I prescribed for this guy and his quite nasty ulcer was the herb gotukola, or the botanical name is Centella asiatica. And this is actually what seemed to do the trick. I got him to take it internally and also made up an extract for him to use 4 times a day as a wash. So he washed the wounds with this extract diluted in water 4 times a day, and over a period of 4 to 5 months the ulcer slowly but gradually healed. And this early success really confirmed for me the enormous healing potential of plants as medicine. In the previous lesson, you learned about the pillars of health: sleep, exercise, hygiene and nutrition. These are things that we need to incorporate into our daily life. I'd like to add a few more to this list of pillars of health. I think that fresh air is a really important factor. Sunlight, regular exposure to sunlight is very important. Pure water on a regular basis is important. Rest and relaxation we can't underestimate. And exposure to the natural environment. Failure to incorporate these into our day-to-day life inevitably contributes to imbalance and eventually disease. Living in the 21st century and living an urbanised Western-type lifestyle, it's easy to deprive ourselves of these critical habits, and consequently our quality of life is often not ideal. Furthermore, it's estimated that around about 75% of the chronic diseases that afflict Western societies today are a result of poor lifestyle choices. Consequently, lifestyle medicine is becoming a growing part of allied healthcare these days. Lifestyle modification, encouraging and motivating patients to make healthy lifestyle choices, is and always has been a part of, or a cornerstone, I suppose you'd say, of naturopathic medicine. Probably more important these days than ever before. Massage or musculoskeletal therapy and homeopathy are other main therapeutic modalities that naturopaths draw upon, and these will be covered in some detail in later sessions. One final point I'd like to make, though, in relation to the different therapies used in naturopathy, is that they're chosen carefully and specifically to meet the health needs of the patient.